Hey everyone, as usual, and whenever I'm at a meeting, I'm always trying to bring you guys the latest and the greatest new technology, whatever interesting things that I see. So I'm at the 10th annual Robotic Assisted Microsurgery and Endoscopy Society meeting here in Florida. And I happen to run across a vendor, Poiesis, that has an interesting product. I have never seen it before. And you know what? We all think that whatever we do in our practices, everyone else is doing. Well, that is not true, because I know a local urologist, according to Charlene here, local urologist in my area who's been using this catheter for years, and I had no idea about this catheter. So we're going to talk about something called Duette by Poiesis. It's an interesting catheter and has some distinct advantages. I've never seen anything like this, so I thought I'd bring this to you guys. All right, Charlene, tell us about this catheter.
Oh, sure. Hi, my name is Charlene Johnson, and this is the Duette. It is dual balloon. Unlike a Foley, it has two balloons. And you say, well, what's the difference? Why does that make a difference? So just like a Foley, you have a retention balloon, and that balloon's been in the bladder for 80 years now, since Dr. Foley. Actually, it might even be 90 years. What we've done, and the inventor of the Duette has done, is added a bladder protection balloon. And why is that important? Because once that bladder collapses, it collapses on a tip with the Foley catheter, but with the Duette catheter, it's a cushioning balloon. And then the drainage eye is located in between the two balloons, so you get that constant, uninterrupted drainage.
Yeah, so that is the major advantage. So of course you want the catheter, anytime someone has an indwelling catheter, you want it to be draining all the time, and having this allows the bladder to be drained, possibly decreasing the risk of infections.
Absolutely, because what can happen is the tip of the catheter with the current Foley design causes damage inside the bladder, and that's actually where the bacteria attaches.
And then often you guys have done cystoscopies after someone who's had an indwelling catheter, even for just a few days. You see the mucosal irritation, and I haven't used this, so I'm really curious to see what the bladder looks like after someone who's had an indwelling Duette catheter.
We do have that on our website, poiesismedical.com.
Okay, well, very good. Now, of course, we're going to be, everyone's like, oh, this is a great idea. What is the makeup of this catheter, and how do people get a hold of this catheter?
So it is 100% silicone, so it's much more biologically inert, much healthier for the patient. It doesn't track the biofilm and the incrustations, but you can source it through McKesson, Medline, Byram, Owens & Minor, Cardinal Health, all the big distributors.
And soon to come, UroGPO, right?
Yes, and soon to come UroGPO. Thank you.
Very good. Now, silicone catheter, I don't know if you all know this, but latex catheter for the same outer diameter, silicone catheters have a larger inner diameter opening, so even better drainage. And interestingly, when I held this catheter, I know you guys can't feel it, when I held this catheter, it's actually not stiff like the most silicone catheters,
yes,
which are stiffer.
Yes.
But this is actually really soft, so comfort to the patient is also important, obviously.
Absolutely.
Well, very good. Now, for those who may be interested in this catheter, how do they get a hold of you or your company?
Poiesismedical.com. We have all of our contact information there. My email is charjohnson at poiesismedical.com. And again, if you just go to our website, there's actually a form that you can fill out.
Oh, wonderful.
Yeah,
so as usual, I'll leave the link in the video description for those of you who are interested. So thank you so much for sharing your innovative product.
Yes, it's a pleasure. Thank you.
All right.